We designed appropriate empiric therapy for HAP and VAP, and we de-escalated from empiric therapy to pathogen-directed therapy. We also evaluated patients' clinical stability to switch from IV to PO and recommended appropriate duration of therapy for HAP and VAP. Now let's develop a patient-specific plan for prevention of pneumonia. When it comes to the prevention of pneumonia, the older 2007 IDSA guidelines has several recommendations. Of course, influenza can lead to secondary bacterial pneumonia, so influenza vaccine is recommended, as well as pneumococcal vaccine, which I will discuss shortly. Now, for patients who are hospitalized, vaccination can actually be performed at discharge prior to patients going home, and of course, it can also happen in the outpatient setting. Smoking is a risk factor for pneumonia, so smoking cessation is very important in preventing community-acquired pneumonia. And those who continue to smoke, influenza and pneumococcal vaccination is really important for them. And of course, respiratory hygiene, including washing hands, is really important in preventing spread of germs. The new 2019 IDSA guidelines did not make any new recommendations for prevention of pneumonia. Now, before we talk about pneumococcal vaccines, it's important to distinguish between pneumococcal disease and meningococcal disease. So when people talk about pneumococcal disease, in general, they are referring to pneumococcal pneumonia or pneumococcal meningitis, which are caused by the organism Streptococcus pneumoniae, which is a gram-positive coccus. Now, this organism Streptococcus pneumoniae does have an outer capsule that's composed of polysaccharides, and because there is variation in this polysaccharide, there are more than 100 serotypes that are known. So the vaccines that we have are targeted at different serotypes. In general, we have two types of pneumococcal vaccines. We have pneumococcal polysaccharide vaccine, so it's literally they have taken the polysaccharides and they have put it in there. So Pneumovax 23 has 23 different serotypes in there. We also have pneumococcal conjugate vaccine. These are vaccines that are conjugated to a protein to improve immunogenicity, and there are currently 4 of them on the market. So PCV13, which targets 13 serotypes, PCV15, PCV20, and PCV21. Now, in contrast, we have meningococcal disease, which essentially means meningococcal meningitis, and this is due to organism Neisseria meningitidis, which is a gram-negative coccus, so it's very different than Streptococcus pneumoniae. And similarly, it has different, because it has a capsule, there are different serogroups. There are 12 serogroups that are known. Worldwide, serogroups A, B, C, W, X, and Y cause invasive disease, whereas in the US is more likely to be serogroup B, C, and Y. And there are different vaccines on the market. So, for example, there are the ones that target serogroup A, C, W, Y. There are some vaccines that target only serogroup B, and more recently we have vaccine that targets all 5 of these that are most commonly causing disease, including Pembrea and Penmenvy. So if somebody wanted to prevent the risk or reduce the risk of developing meningitis, essentially because there are 2 organisms that cause meningitis, they need vaccination against Streptococcus pneumoniae, so pneumococcal vaccine, as well as vaccines against Neisseria meningitidis, so meningococcal disease. Now, when we give pneumococcal vaccine to people, so for sure, we are trying to prevent pneumonia, but more importantly, it is also reducing the risk of developing meningitis. So that's something important to keep in mind. In fact, when Streptococcus pneumonia causes invasive disease, typically pneumonia, which can be non-bacteremic for the most part, but some of these can be bacteremic pneumonia. So, when you have bacteremia, it can make it throughout the body, and when it makes it to the brain, you will have meningitis. So these are relatively less common, but certainly more fatal. Now, as of this recording, there are 5 pneumococcal vaccines available on the market. The first one is the Pneumovax 23. So this is targeting 23 different serotypes, and it is approved for age 2 years 2 years and older. These are essentially all of them 0.5 ml intramuscular injections, but Pneumovax can also be administered subcutaneously, and they all need to be stored in a fridge. So refrigeration is required, but not freezing. Prevnar 13 targets 13 of these serotypes. Then we have Vaxneuvance, which is PCV 15, Prevnar 20, which is PCV 20, and Capvaxive, which is a PCV 20. Now, with the exception of PCV 21, they're all approved for adults and children. And the PCVs, which are pneumococcal conjugate vaccines, differ from PPSV, which is polysaccharide vaccine. They're essentially conjugated to CRM197 carrier protein. So all 4 of the PCVs are, that's how they are conjugated, and that improves immunogenicity, which I'll explain in a minute. But also another thing to keep in mind that PCV 13, 15, and 20 also have aluminum in them as an adjuvant to further enhance immunogenicity. The latest one that has come to the market, PCV 21, does not have this adjuvant. So that's something to keep in mind, and I'll mention that shortly. Now let's take a look at which serotypes they cover. So you can see that PPSV 23, which is the oldest one, covers 23 different serotypes. And again, keep in mind that there are over 100 different serotypes. So essentially, we're trying to target the ones that are more likely to cause disease. Now, PCV 7, which is no longer on the market, targeted 7 of these that are also included in PPSV 23. In general, the response from PPSV 23 is not great. That's why we are trying to have different PCVs, and it's more difficult to create PCVs because they're conjugated to protein, and proteins are much larger molecules, so they're more difficult to include as many serotypes as possible in a single shot. So over years, we have seen the evolution of these PCV vaccine. So PCV 13, which is still on the market, covers 13 of these. PCV 15 added 2 more to PCV 13, and then PCV 20 added even more to PCV 15. Now, one thing that's interesting, the latest one, which is PCV 21, is not necessarily adding to the previous one. So it has it actually excluded some of the ones that they think are no longer causing disease because of years of vaccination and herd immunity. But they have introduced a bunch of new ones that are causing disease in adults specifically. So the previous ones were specifically targeted at children, whereas PCV 21 is more designed for adults. And here's what I mean. So when you see in this, we're looking at different age groups. So we're looking at what percentage of invasive pneumococcal disease is due to specific serotypes. And the blue is what's included in PCV 20 but not in PCV 21, whereas the gray is included, is common in both PCV 20 and PCV 21, and then orange is included in PCV 21 new and is not in PCV 20. So when you look at this, for example, in adults, you can see that somewhere between 54 to 62% of invasive pneumococcal disease were due to serotypes that were included in PCV 20. But when you look at PCV 21, that actually improves it. So somewhere between 77 to 85% of invasive pneumococcal disease cases in adults are actually covered by PCV 21. So that's why PCV 21 was designed to improve essentially prevention of pneumococcal disease in adults specifically. Now let's take a look at some of these vaccines. So PPSV 23, which is the oldest one on the market, came to the market in 1983. Because it's pneumococcal vaccine, it does not depend on T cells, and because infants or toddlers under the age of 2 have not matured their immune system, you're essentially not going to have immunogenicity in age under 2 years. So PPSV 23, for that reason, because it does not activate the T cells, it is not used for under age 2. Now, this does cover 23 valents, and essentially the studies have never shown that it can actually reduce the risk of pneumonia, but certainly it can prevent invasive pneumococcal infection, specifically meningitis. So there is certainly value in administering it to people. And then PCV13, which is the better formulation, so it's conjugated, so it has enhanced immunogenicity that depends on T cell, and for that reason it does work in children under the age of 2, so it's approved for anyone 6 weeks old and older. So it's part of, or it has been part of childhood immunization schedule. And in fact, it came to the market for children first before it came to the market for adults since 2010. And it has been proven to prevent not only meningitis but also pneumonia. So PCV13 is definitely more valuable than PPSV23, but because it only covers 13 serotypes, they definitely need to be administered in combination, not necessarily at the same time, but I'll go over the schedule shortly. Now, the new pneumococcal vaccines, so PCV 15, 20, and 21, have come to the market in the past few years. So since in 2021, we saw that PCV 15 and 20 came to the market for adults first, followed by approval for children. And PCV 21 currently is only approved for adults. Now, these are essentially come to the market based on immunogenicity data. So we don't have efficacy data for any of these. So in other words, nobody has done studies to show that they can prevent pneumonia or meningitis. What they have done is to show that they can trigger the immune system to have antibody response against these serotypes that are included. So PCV 15, 20, and 21, they all have shown that they can have robust immune response. Now let's take a look at guideline recommendation from CDC's ACIP for adults. So there are 4 different groups of people that we can take a look at, and for each of these groups we can also look at age cutoffs. So in general, there are recommendations for people aged 50 years or older, and of course from age 19 to 49. And then these are for people who are pneumococcal vaccine naive or unknown status. So in other words, for people who have received their full pneumococcal vaccination during their childhood immunization, these recommendations do not apply to those people. And for many of these people, when they were children, essentially for most of these people, pneumococcal vaccine for childhood immunization did not exist. So large majority of older people will most likely be pneumococcal vaccine naive. So the first group is healthy people, and this is essentially people with no other risk factors. So essentially, since these people do not have risk factors until they are 50 years old, there is no recommendation for receiving pneumococcal vaccine. And then once they turn 50, it is recommended to receive 1 dose of a PCV vaccine. So that could be either 1 dose of PCV 15 or 1 dose of PCV 20 or 1 dose of PCV 21. And then for PPSV 23, it is recommended to receive 1 dose of PPSV 23 if the patient had received PCV 15. In other words, if the patient had received PCV 20 or 21, there is no need to also get PPSV 23. Now let's take a look at the timing of these vaccines. So essentially, if people need to get these, it is, if it's PCV 20 or 21, it's just a single vaccine. So there is no PPSV 23 to follow. So that one is straightforward. However, if the patient is to receive PCV 15, it is recommended to get the PCV vaccine first because the PCV vaccine is the most effective. And then at least a year later, they can get the PPSV 23. So PPSV 23 is less effective, less immunogenic, but it will add extra coverage for those extra serotypes that are not included in PCV 15. It is important to keep in mind that PCV and PPSV 23 should not be co-administered in the same visit. So there has to be, some time between the 2 doses. So they should not be given at the same time. Now, if for some reason somebody had already received PPSV 23 and now they're coming to you and then you realize that they have not received their PCV, it is important to give them one of the PCVs, and at this point you can do PCV 20 or 21 as well, but again it has to be at least 1 year apart. Now, vaccine doses do not need to be repeated if given before age 50 years. In other words, if somebody had received PCV 20, let's say at age 45, once they turn 50 they do not need to be repeated. When PCV 15 is used in those with history of PPSV 23, it need not be followed by another dose of PPSV 23. So again, so if that PPSV 23 was given, let's say at age 45, once they get their PCV 15 at age 50, there is no need to chase it with another PPSV 23. Now let's take a look at the second group of people. So this is the immunocompetent people who have some risk factors for pneumococcal disease, and those risk factors include alcoholism. And alcoholism, per CDC's definition for female, is having 4 or more drinks on an occasion in the past 30 days, and a drinking occasion is considered to be approximately 2 hours. So if there is a party and within the 2 hours there were 4 drinks consumed, that would be considered. And for males, the same definition, but it's 5 or more drinks on an occasion. Next is chronic heart disease, and this is things like coronary heart disease or heart failure but not hypertension, chronic liver disease such as cirrhosis, chronic lung disease such as COPD, cigarette smoking, and diabetes mellitus. So for these group of people who have risk factors but they are considered immunocompetent, it is recommended to get a dose of PCV before age of 15. So sometime between age 19 to 49, they need to get 1 dose of any of these. So it could be PCV 15, 20, or 21. And of course, if they do get PCV 15, it is recommended to follow up with a dose of PPSV 23 just to give those extra coverage. If it's PCV 20 or 21, there is no need to get the PPSV 23 because 20 and 21 give enough coverage. So again, here's the timing. PCV 2021 is just a single shot. If it's PCV 15, at least 1 year later, there will be a PPSV 23. Now, for this group of patients, once they got their complete immunization of pneumococcal vaccines before age 50, when they turn 50, they don't really need to get vaccines. However, if they had not previously received the vaccine, once they turn 50, they should get their PCV vaccine. And of course, if that PCV happened to be a PCV 15, they also need to chase it with a PPSV 23. Otherwise, if somebody has completed these vaccines prior to age 50, neither PPSV or any PCV is needed after age 50. For the third group, which is immunocompetent persons but with a super extra high risk, so these are patients with CSF leak and cochlear implants. So these are very high risk of getting pneumococcal meningitis. And the fourth group is immunocompromising conditions such as asplenia, cancer, chronic renal disease, HIV infection, immunodeficiency, sickle cell disease, and solid organ transplant. So for these last 2 groups, the recommendations are still the same. So prior to age 50, they do need to get a complete series of PCV followed by a PPSV 23. And then once they turn 50, they don't really need to get anything unless they have not previously received one, then they complete. The only thing different for group 3 and 4 is that if they do get PCV 15 and they need to chase it with a PPSV 23, the time between the 2 can be shortened to 8 weeks just because these are super high risk patients. So you want to accelerate their full protection. So therefore, it is recommended to, instead of waiting 1 year after PCV 15 to give the PPSV 23, to do so within 8 weeks. And of course, if for some reason the patient had already received PPSV 23, it will be 1 year later that they will get any of the PCV vaccines that are available on the market. Now, one last thing that's recommended in the guidelines is that in certain populations in which more than 30% of pneumococcal disease is due to serotype 4, pneumococcal vaccine that includes serotype 4 are expected to provide broader serotype coverage against locally circulating strains than does PCV21. So remember that PCV21 does not include serotype 4, whereas the rest of these vaccines include serotype 4. So for those patients, the guidelines recommend PCV20 alone or PCV15 plus PPSV23. Now, which areas are at this increased risk of serotype 4? So this is essentially in Alaska, Colorado, Navajo Nation. So Navajo Nation, I have provided a map here that there are certain areas that span over Arizona, New Mexico, and Utah. And of course, other areas include New Mexico and Oregon. So if the patient resides in these areas, they are at increased risk of serotype 4 pneumococcal disease. So for these patients, it is recommended to use a vaccine that covers serotype 4.